Hello and welcome to our live stream event as we discuss optimizing sleep health for women and people who are assigned female at birth. My name is Ed Bottomley with the Michigan Medicine Department of Communication, and our panel includes three experts who will help answer questions about how women can get the right amount of sleep to ensure health and well-being. First, I'll turn things over to our three experts for some quick introductions. If we could start with you, perhaps, Dr. Padia. Oh, I think you're muted.
Hi, my name is Dr. Hiral Padia. I'm one of the sleep medicine fellows at University of Michigan, and I'm happy to answer your questions today.
Fantastic. And Dr. Shelgikar?
Hi, everybody. I'm Dr. Anita Shelgikar. I'm a professor of neurology and director of the Sleep Medicine Fellowship Program here at Michigan.
Thank you both. And last but not least, Dr. Conroy.
Hi, everybody. My name is Deidre Conroy. I'm a clinical sleep psychologist in the Department of Psychiatry at Michigan Medicine, and I'm the clinical director of the Behavioral Sleep Medicine Program.
Well, thank you all three for attending today. Before we start, just a few housekeeping items. You can submit questions at any time for our panel to answer during the Q&A portion of today's chat. Questions can be submitted by commenting on this video, but please note that your name or your profile name will be visible to others participating. If you prefer a more anonymous option, you can send a private message to us via the relevant social channel that you're viewing this on. If you can't stay for the whole chat, or you want to share the recording with a friend, a video of the chat in its entirety will be available on our flagship Michigan Medicine YouTube channel. So let's kick things off with our first question. I'm going to push this to you first, Dr. Shelgikar, but I know others can add answers too. The question is, what happens to the body and brain during sleep, and why is it so important?
Great. Thanks for that question. There are so many restorative processes that happen during sleep. And this is one of the most exciting things about our field of sleep medicine is that the more we learn about sleep, the more we learn about its vital role in so many healthy biological functions. So I know over the course of our discussion today, we'll be talking about effects on the cardiovascular system, effects on attention and memory, effects on other aspects related to our health and well-being. And so those are just a few of the things that are affected by a good night's sleep.
Thank you so much. Do either of our other two experts want to add anything to that?
Yeah, sleep is really important, like Dr. Shelgikar said, not only for physical and mental health, but also immune function and cognitive performance in addition to emotional well-being, and that improves your overall quality of life as well.
Thank you. Let's jump on to our second question. Do men and women require different amounts of sleep? What are the different barriers that women face that could disrupt or perhaps disturb their sleep? And I'll push that to you first, Dr. Shelgikar.
Sure, thank you. So the recommendations for adults are to get at least 7 hours of sleep per night. And these recommendations are across the board for all adults. So they're really age-based recommendations. They are not based on sex or gender. And I think that's a reflection of where the science is right now. I don't know that we know yet if men, women need different amounts of sleep at different phases of the lifespan. So right now we have kind of an all-comers based on age recommendation for total sleep time. Some of the barriers that can be unique to women are both in the realm of comorbid medical conditions and also other social, occupational, and family-related responsibilities. And all of these things can sometimes meld together, and it's really hard to tease apart as people are living their daily lives. What are the barriers that influence the ability to get the amount of sleep that a given individual needs? But we do recognize that all of these factors play a really important role, either in facilitating someone's ability to get enough sleep or really, becoming things that we collectively as a team try to work on to make sure that people can get the amount of sleep that they need.
Thank you so much for that, Dr. Shelgikar. I see nods of agreement from our other two experts. If you have anything to add, don't hesitate to jump in. So go ahead, Dr. Conroy. I saw you on mute.
Oh, thank you. I was just going to add the final thing that Dr. Shelgikar said was the individual needs. And that is something that we, as providers, hear so much about, is that everybody does have their unique circumstances and needs. And we try to incorporate that into our teaching and our treatment plans.
Yeah, thank you. An important point there. Question number 3. For you all, how is the amount of sleep needed impacted by age, perhaps life cycle? I'll pass that to you first, Dr. Padia.
Sure. Yeah. Thank you. So, as we all know, infants require a lot of sleep, and they require the most sleep, typically between 14 to 17 hours. And this gradually decreases as we get older. So toddlers and preschoolers need maybe 11 to 14 hours, and then school-age children, 11, maybe 9 to 11 hours. Teenagers require still a significant amount of sleep, around 8 to 10 hours per night. Of course, we talked about how things can vary person to person. And some may find that teenagers have difficulty falling asleep earlier due to changes in their biological clock. If anyone here has teenagers, they might understand the difficulty with teens staying up past midnight and then it being very difficult to wake them up in the morning for the school. It's a common issue that a lot of teens have. And then in adults, we already talked about the American Academy of Sleep Medicine recommends at least 7 hours of sleep per night, and it's very individualized, so there's some people that are shorter sleepers and there's some people that are longer sleepers. It's important to pay attention to your daytime symptoms to kind of figure out where you fall. And if you find that it's taking you, say, more than 9-10 hours to feel rejuvenated and less sleepy the next day, it's something that you should definitely talk to your primary care doctor about. And then in older adults, they may find it difficult to get a full night's rest, and they may have some sleep fragmentation. And so we still recommend that adults get at least 7 hours of sleep per night. And then there's a lot of things that can cause more severe sleep fragmentation in the older population, which we should definitely investigate if that is there.
I just wanted to add on to what Dr. Padia said. I totally agree with everything that she said. And I think one thing you're hearing from all of us is this emphasis on an individual's need for sleep. Even all of us on this call right now may have different biological individual needs for sleep. And it's so important to understand that. And that can ebb and flow sometimes over the course of the lifespan. Again, in the context of other medical conditions, of the work schedules that we keep, for example. And so really understanding the context and the need that we all have as individuals for sleep is really critical. And sometimes we see with our patients that people will go for a long time with having sleep quality that's not so great. And it's not until something is done or changes that they realize, oh, okay, that I can see the difference now. So just emphasizing what Dr. Padia said about sleep quality, that's something that we think is paramount for good health, and that if that seems lacking, that's really an opportunity to talk with a healthcare provider.
Thank you both for that. For the next question, I think I'm going to push to you first, Dr. Conroy. And the next question reads, what happens when someone gets inadequate sleep? What conditions are they at risk for? And how does it impact their quality of life?
Yes, thank you for this question. And, this is one of those things that we can all identify with. We've all, at one point in our lives, had a poor night's sleep. If you haven't, you're probably not listening. So we can all answer for ourselves what happens after a poor night's sleep. And it usually, at least what I hear from my patients, is that I am irritable. I am in a bad mood. I'm not as effective. That word comes up a lot at my job. You may find that your ability to think or your cognition starts to change, word finding problems. So it can affect every part of us. Particularly, I mentioned mood changes. And this is something that the research is really kind of looking at, is how sleep difficulties affect mental health and other types of even our mental and physical health. we're really kind of seeing this bi-directional relationship where sleep difficulties may lead to future mental or physical health problems, but also mental and physical health problems can cause sleep disturbances as well. So the arrow can be pointing both ways, but many people who experience difficulty sleeping may also experience an exacerbation of already underlying conditions like migraines, for example, or underlying pain conditions can be worse after we've slept poorly.
Yeah, I'd like to add on to what Dr. Conroy says. We really think that sleep is essential to health, just like adequate nutrition and adequate exercise. We really look at it as a pillar of overall health and well-being, and that, not thinking of it as a siloed need or something that, I'll get to it when I get to it, but really thinking about it as part and parcel of management of just our overall health and even specific medical conditions, like Dr. Conroy mentioned, that there is evidence that if you are trying to treat depression or migraine or other things, that improving sleep can even help with management of those other conditions as well.
Thank you for that addition as well, Dr. Shelgikar. Next question, how do hormonal changes affect a woman's ability to get enough sleep? Things like pregnancy, puberty, perhaps menopause. And I'll push that to you first, Dr. Shelgikar.
Yes, thanks for this question. I think this is a really important and intriguing question. And I think this is an area of, active research ongoing right now. I think Dr. Padia mentioned the differences in sleep need across the lifespan. And again, that's based on age, but then we can do these even deeper dives looking at metabolic and physiologic changes at even shorter areas within the lifespan. And we have a colleague, Dr. Louise O'Brien, who's done a lot of really groundbreaking work looking at sleep in pregnant people, and things like the duration of pregnancy, being able to extend pregnancy to full term, looking at outcomes related to the fetus and the birth of the child. So I think this is a burgeoning space where we are learning a lot more, but the evidence does show that there are changes related to the hormonal status, as women progress through their lives. I think one area where it's a little bit more well understood is in menopause. The hormonal balance does change, and we do see that women's risk for obstructive sleep apnea, which is a sleep-related breathing disorder, does rise in the setting of menopause. So there is something about that hormonal influence that affects the collapsibility of the upper airway and does make it a little more likely for women to develop obstructive sleep apnea at that phase of life. So I think this is an active area where we are learning more.
Thank you. And again, if either of our other two experts want to jump in, don't hesitate to do so.
I just wanted to
go ahead
real quick. I just wanted to also add in, especially those that are pregnant, there are weight changes that come along with pregnancy and other changes that, getting treated for if you do develop sleep apnea just during the time of pregnancy, that could be a really great way to, get treated at that time and also improve your outcome with your pregnancy and your baby's health.
Thank you, Dr. Padia. Thank you for that. Next question, or actually two questions. What are good sleep habits for women, and what are some of the bad ones to avoid? And I'll pass that to you first, Dr. Conroy.
Yeah, this is such a great question. I get asked this question so often in my clinic. So the question was, what are some good habits to maintain? What are some bad habits maybe to avoid? So the good habits are, thinking along the pillars of good health. So good exercise routine, good routine. I often say routine because that applies to your sleep-wake schedule. So many of us are so tired on the weekends and we sleep out later. And that's one of the things that we really talk about in terms of improving sleep is keeping that regular sleep-wake schedule. So routine with sleeping and eating, nutritious, healthy foods, exercise routine, and some kind of relaxation or quiet time built into your routine can also help just settling the mind, because the mind can often keep us awake at night. So speaking of keeping us up awake at night, so what are some bad habits that we've developed? So most of the time I do talk to people about our devices and our world that we live in, which is nonstop, and the access to information and social media is nonstop. And it really does affect the brain's ability to calm. So if you are checking your email or checking your social media just before bed, or even during the night, I have my patients out there who, they're bored, so they scroll their phone during the night, but it's really kind of like a dopamine hit, right? It's like, it's so rewarding to get that information that you're looking for. So I would say media is one of the things that can get in the way of sleep. So trying to avoid that, really setting up your sleep environment that is conducive to sleep. Many of us are working from home, and still our offices might be our bedrooms. So having the disconnect from, if your office is in your bedroom or your office is at work, really disconnecting from work still applies. So disconnecting, having a sleep conducive environment is really important on top of everything else.
Yeah, thanks for that, Dr. Conroy. So Dr. Conroy is certainly an expert in this space. I think many of us refer our patients to her for her guidance that she shares with patients. I would just add that we're all human too, and sometimes our best efforts. Sometimes we have nights where we did look at the phone, or we didn't do all the things, and that's okay. To just remember to keep prioritizing it. And if you stray a little, just to come back to these, central tenets that Dr. Conroy shared, because it's not necessarily that we have to be perfect every night, but if we can start to develop the habits and just kind of integrate them as part of our nightly routines, they do become a little bit easier. And then it is kind of a positive feedback of feeling better after a better night's sleep.
And just one more thing to add to that is that, a theme of our conversation today is what is unique about women, people socialized as women, is that there could be a greater sense of responsibility or caretaking needs. And sometimes this interferes with sleep. And so I have discussion about what is on your plate. Is there anything that could be delegated? How available are you? So many of my patients sort of keep their phones because someone might be needing them during the night, which of course you want to be safe, but just having that discussion or reviewing what in your life could stay or what could go could all impact sleep.
Yeah, thank you for those answers there. The next question I'm going to push to you first, again, Dr. Conroy. What sleep disorders are women more at risk for? And what are they? And when is it time to get expert help? I'll read that one more time. What sleep disorders are women more at risk for? What are they? And when is it time to get expert help?
Great. Yes, thank you. So in terms of sleep disorders, insomnia really does rise to the top of the list. And in fact, the research continually shows that women are more likely to develop insomnia. In fact, they're twice as likely as men to develop insomnia. But also echo what Dr. Shelgikar said earlier about obstructive sleep apnea. In the postmenopausal years, the rates of obstructive sleep apnea can rise in women and become equal to those of men. So incidence of sleep apnea. So insomnia and sleep apnea are two that come to mind. Restless leg syndrome is another one, which we'll get to in a moment. And so these are some of the more common sleep disorders in women. And the second part of that question.
Sure. The second part, when is it time to get expert help?
Thank you. So getting expert help, first I want to encourage people to have the conversations with their doctors about sleep. So often this is a conversation that's had on the way out or just before the Zoom call ends. So having an ongoing dialogue with your provider about sleep is important. But in terms of expert help, does this become sort of a problem or disorder? One thing to keep in mind is, how is this affecting my daytime or your waking hour functioning. So is it affecting my functioning? And really, if it's going longer than about 3 months, and you've been suffering from, at least with insomnia, 3 times a week at least for about 3 months, that's what we would put in terms of the chronic insomnia category. And that's definitely a time in which you could probably benefit from more formalized therapy.
Thank you for that, Dr. Conroy. The next question I'm going to actually push to all three of you. This is something we touched a lot on earlier in this live stream. What are the potential downstream effects of sleep disorders? Perhaps mental health, cardiovascular, metabolic?
Maybe Dr. Padia, would you like to kick us off, and then we can touch on the other things?
Sure, yeah. So I can touch on the metabolic aspect. So metabolic is, when we refer to that word, we're talking about how we store energy and use energy. And when I think about it, it can really sleep can affect it in 3 ways, I think. So number one, poor sleep has been linked to impaired glucose metabolism, and that can lead to things like insulin resistance and increased risk of type 2 diabetes. And then sleep deprivation has been shown to increase appetite and weight gain. So in the research, it's shown that sleep deprivation is known to increase certain hormones that stimulate appetite and also decrease certain levels of hormones that signal fullness, and that can lead to increased hunger and overeating, and that can contribute to weight gain and obesity. And then the last thing is, it reduces your energy expenditure. So that's what we call the basal metabolic rate. So when you're at rest, your body is using energy. And when you have poor sleep, it's been shown that that amount of energy that you're using at rest is actually reduced as well. And that can also contribute to weight gain.
Thank you so much for that. Dr. Shelgikar, I see you've unmuted. Do you want to go next?
Sure. Yeah. So thank you. To add on to that, I think this is something that all of us as sleep medicine specialists really feel passionately about all of the downstream effects from poor sleep and from sleep disorders that are untreated. You had asked about cardiovascular side effects. So when we talk about cardiovascular, we think about things like high blood pressure or hypertension, abnormal heart rhythms, risk of heart attack. And so all of these things are things that have been studied. High blood pressure in particular, for example, has been shown in association with things like untreated obstructive sleep apnea, with insomnia, with periodic limb movement disorder. So that we know that there's definitely a footprint that's left on the cardiovascular system in the setting of sleep that's either insufficient in quantity or in quality in terms of some other disruption to sleep. In the setting of obstructive sleep apnea, particularly severe obstructive sleep apnea that's left untreated, we do see a risk that accumulates over time of abnormal cardiac rhythms, such as atrial fibrillation, and even risk of heart attack as well. So we do see that sleep does have a direct impact on cardiovascular health. And I think Dr. Conroy could share about the effects on our mental health.
Yes, thanks, Dr. Shelgikar. So one of the most common residual symptoms in depression treatment is insomnia. And so we also know that when you treat depression in combination with something called cognitive behavioral therapy for insomnia, where the therapy addresses the sleep disturbance, we can find that depression scores improve and insomnia scores improve as well. So addressing the insomnia as part of the picture is very important.
Thank you all three for jumping in on that question. We are about half an hour into our live stream, and I just want to remind our viewers that questions can be submitted by commenting on this video. Please note that your name or profile name will be visible to others participating. And if you prefer a more anonymous option, you can always send us a private message via the relevant social channel that you're viewing this on. So let's dive in back into the questions. This one is for you, Dr. Shelgikar. It's a 3-parter. What impact does pregnancy have on a woman's ability to sleep? What about challenges of sleeping when you have a new baby, and perhaps if you're breastfeeding?
Right. These are all really important questions and big questions. And I think these are on people's minds as they head into pregnancy and during pregnancy and thereafter. So the first question had to do during pregnancy, correct?
Yes, first was during pregnancy.
Okay. All right, great. So as Dr. Padilla had mentioned earlier, there are many physiologic changes that are expected and anticipated during pregnancy. And many of these do have an influence on sleep, particularly as the pregnancy progresses. And in the third trimester, some of these things can be really accentuated. So one is even just difficulty sleeping. Trying to, the recommendations are to sleep on one side, and sometimes that can be really uncomfortable on someone's hip or shoulders. And so even just finding a comfortable sleeping position can sometimes be difficult or challenging and require a little creativity or adjustments to the sleeping environment. As the pregnancy progresses, there may be some fluid that accumulates in the legs, for example. And when we sleep, if we're lying flat or even on our side, some of that fluid can move up towards the airway, can make the airway a little bit more collapsible and increase the likelihood of having snoring or even obstructive sleep apnea. Something called rhinitis, or kind of secretions in the nasal passages, can also increase during that third trimester, and that too can impact breathing and airflow during pregnancy, during sleep in particular. And then restless leg syndrome, which I think we will talk about a little bit later, is also something that can increase during pregnancy, oftentimes if there's a genetic predisposition, but that's something that people may not have experienced before pregnancy that can occur to varying degrees during pregnancy. So, all of these things are, they may happen in combination or they may happen in isolation during pregnancy, and they do merit a conversation with your healthcare provider. So it's not something that needs to be toughed out. These are things that we can help with during pregnancy.
Thank you. Thank you for pointing that out. I think the other two parts of the question were with regards to difficulties and challenges of sleeping when you have a new baby, and perhaps if they're breastfeeding.
Okay, thank you. Yes, challenges with a newborn. This is, an age-old question, right? There's often the advice, well, sleep when the baby sleeps, which if you are able to do that, then fantastic. I think being able to catch up on sleep during those times can be protective. Overall, we think about the amount of sleep that women need in that perinatal period. We know that postpartum depression is a real thing for women after pregnancy, and that sleep directly impacts that. And sometimes this needs to be part of a larger discussion about who else is involved in the care of the infant. There may be other children in the home that require care as well. There may be occupational or other family responsibilities. So there may be multiple factors that influences somebody's ability to get a certain duration of sleep, either continuously as one sleep period during the night, or even to be able to nap during the day. So this is something that, again, to talk with someone's obstetrician about primary care, if you are seeing us in one of our sleep clinics. But sometimes this takes a real team effort to be able to identify what's the best solution, and that may change person to person. But we do know that this maternal sleep is very, very important for the mom's health and to be able to safely care for the child as well. In terms of breastfeeding, that can cause some disruption to the sleep schedule during the night, especially for really young infants that require multiple feedings throughout the course of the night. One of our sleep medicine fellows a while back had done some research looking at sleep stages in women who are breastfeeding, and found that maybe breastfeeding provided a little bit of protection and maybe a little bit more deep sleep in that setting, but this was a rather small study. So I think we have more to learn about that. But I think it still comes back to finding a schedule that works for the mother, that works for the whole family unit, however that is defined in terms of, again, occupational, family, and other support to be able to prioritize sleep as best as possible.
Thank you. And thanks, Dr. Shelgikar. And I just also wanted to highlight the importance of the mother's mental health, and that there are resources, particularly through the Department of Psychiatry. We have a great perinatal depression team, perinatal depression and postpartum depression, just generally, but we also have two excellent clinical psychologists by the name of Dr. Greta Ragland and Dr. Leslie Swanson, who work clinically with women during pregnancy and post-pregnancy on sleep and how to manage their sleep after having a baby. So there's other resources there for those that are interested.
Thank you for answering those questions there. The next one we have, I'm going to push to you first, Dr. Conroy. What can women try at home to sleep better? Are there over-the-counter medications that you would recommend? And an audience question, does magnesium help with sleep? And I can repeat any of those if needed.
So the first thing that I heard was, what can women do at home, and about over-the-counter medications. So I'll kind of echo what I said before about the home and the disengagement from work or kind of anything that you're involved doing during the day. It's nice to have a separation with bedroom, and the rest of your life. So setting up a bed and bedroom that's conducive to sleep. Perhaps you may be a shift worker, so making sure that you have a dark, cool, quiet environment to sleep in. Again, and I mentioned avoiding distractions during the night. Over-the-counter medications don't have a lot of supportive research on their long-term effects on sleep, meaning that they could lose their effectiveness over time. But intermittent use, particularly, when we talk about hormones and the effects of hormones on sleep, particularly in women, lots of women that I've talked to have difficulty sleeping perhaps prior to their period. They might take an over-the-counter medication for a short amount of time. That's not too much of a problem, but we do want to pay attention to the nightly use of an over-the-counter medication. And alternatively, we know that solutions for long-term sleep management or for insomnia is really kind of a non-medication or less medication approach.
Thank you. And I know there was mention, an audience additional question about magnesium. Does magnesium help with sleep? We have a couple of other audience questions as well. This one, let's open it up. Let's open it up to all three of you. Let's see who wants to answer this one. This is another audience question, and it reads: do you recommend digital apps or a tool for an individual to understand how much actual deep sleep they are getting? Do you guys have any recommendations?
I can answer the question about magnesium.
Oh, yes, thank you.
Okay. Yeah, so we try as best as possible to be as evidence-based as possible, and to follow our clinical practice guidelines. And so when it comes to over-the-counter medications or even some prescription medications, again, we try to go by what the evidence says. And at this point in time, there's just really a small body of evidence for magnesium. So I don't think we really have a robust evidence base to really make that type of recommendation on. I think we do hear anecdotally from patients that it's helpful. But again, this is kind of anecdotal evidence and not really something that we have a kind of a robust evidence base to cite. I don't know if Dr. Conroy or Dr. Padia have anything additional to add about that.
Yeah, I would just also agree that I hear a lot of anecdotal reports that magnesium is helpful. Also hearing some side effects. You don't want to take too much. It can cause GI distress. But yeah, I have my patients that really take it as part of their kind of nightly medications and find it helpful.
Thank you. Thank you both for that. And the next question that we want to move on to, how accurate, we have an audience question about the digital apps. Any recommendation for an app that might give the person understanding about how much actual deep sleep they are getting? And we also have another audience question: how accurate are these devices?
I think that's a really good question, and something that we see a lot in our clinics. you know, a lot of these wearable devices that are coming out now, a lot of them have like proprietary algorithms that they're using to kind of distinguish light and deep sleep that, you know, we don't necessarily always have access to. And so it's hard to know whether or not something is completely accurate unless it's been tested. And so that's what kind of limits our ability to use that data. The gold standard way of knowing whether someone is in deep sleep, light sleep, REM sleep is by doing an EEG. And that's when there's electrodes that go on the head and monitor brainwave activity so we can really look at what stage of sleep the patient is in. There are other types of home sleep apnea tests that we use that can detect, you know, changes in your heart rate and things like that. And we can kind of look at, you know, what state of sleep may they be in. But these wearable devices, I don't know if we have complete evidence whether somebody is getting X amount of deep sleep, light sleep, or REM sleep just by those devices that people have.
Thank you, Dr. Padia. Dr. Shelgikar, do you have something to add?
Yeah, I would agree with everything Dr. Padia said. And, you know, we engage in partnership with our patients and shared medical decision-making with our patients. And so, you know, the nice thing about these consumer sleep technologies and wearable devices is that it gives people more engagement with their sleep. So that's a positive. You know, we do try to put the information gleaned from those devices, understanding their limitations that Dr. Padilla just beautifully outlined in terms of kind of understanding that context, you know, and so it's one piece of the puzzle. It's not something that we rely on exclusively, you know, as we are working through things with our patients.
I will echo everything that's been said so far. So wearables and apps are adjunctive to the work we're doing. I often, regarding the deep sleep question, this is something I see all the time, and not to be the psychologist in the group, but I would ask, why are you asking about that? What's your interest in your deep sleep? That may reflect that you have questions more about your daytime functioning. And if you were able to get deeper sleep, what would that allow you to do that you're not already doing? So for me, it raises a lot of other questions. And just to repeat that the only way that right now we can get deep sleep is if you come into a lab and we hook you up to lots of wires. But online apps can be very helpful in the sense with insomnia therapy. There are some good apps out there that, you know, you can carry with you on your phone. And that can be, like I said, adjunctive to the work that we're doing. And these are getting better every day.
Thank you. Thank you all three. Thank you, Dr. Conroy. I saw nods from our other two experts. We have another audience question that just came in. Do you think taking over-the-counter melatonin pills is harmful in the long run? What about CBD or THC? Not sure if any of you.
Dr. Conroy, do you want to take that one first, or do you?
Sure. I'll touch base on the melatonin and the THC a little bit. I'll take those and then I'll punt the others. So overall melatonin, it's surprising because so many people take it, but there's very, very little research on how effective it is for as what we call a hypnotic, meaning a medicine that, you know, you're taking to help with your insomnia. The specific question was about a long-term. I don't know of any long-term negative outcomes of melatonin. Many patients take melatonin and find it helpful. We find it most helpful, however, in people who have trouble falling asleep, or even in disorders called delayed sleep phase, circadian sleep-wake phase disorder, where you're more of a night owl. We can use very low doses of melatonin to help shift the circadian clock. But overall, I think that the studies on helping you fall asleep, just as a use for insomnia, like I said, is not as good as we would think. Regarding the THC, certainly THC is widely available. Many people are taking it in various forms, and my impression of the research studies is that it can help with insomnia in many cases, also insomnia with comorbid pain. but you definitely want to be aware of how often and how much you're taking. It's very hard to study this because of the different routes of administration in THC, but also keep in mind if you're predisposed to anxiety, that high levels of THC can actually make anxiety a bit worse. So it's a mixed bag, but the bottom line is definitely tell your doctors about that. I do think about it as a part of the medicine routine. And so informing your provider about what you take and how much you take is really important.
Thank you. I don't know if either of our other two experts wanted to jump in, or I see you've unmuted Dr. Shelgikar.
Sure. So, I think these are questions that we are hearing a lot in our clinics, specifically as state level legislation has evolved over the course of time, right? So I think this is sleep medicine in general is a relatively young medical specialty. And I think this particular aspect of it is really in its infancy. I think there is a lot that we still need to learn about the effects of CBD, of cannabinoids on sleep, and particularly on specific sleep disorders, and whether or not there's a role for CBD in, as adjunctive treatment for specific disorders. So I think this is still an area that requires a lot of study. The American Academy of Sleep Medicine issued a position statement in 2018 about medical cannabis and treatment of obstructive sleep apnea, and at that point had said that the evidence available at that point in 2018 was insufficient, and that further research is needed. And so again, I think that there's a big understanding in our medical community that this is something we need to understand better in order to, again, make evidence-based recommendations to our patients. So I think this is an evolving science that we will continue to learn more about in the near term and the long term.
Thank you so much for that. One more audience question has just come in. What if your partner snores loudly and intermittently?
I can answer this question. So, I think one of the best things that you can do for your partner is to let them know that they're doing that and ask them to, consider seeking an evaluation from their primary care doctor and potentially a referral. So snoring is kind of like a screening tool we use for people that have obstructive sleep apnea. And it's caused by an obstruction somewhere in the airway, usually in the back of the throat. Your tongue, when you lay flat, sometimes can fall backwards and cause noise. Also, sometimes it can come from the nose. But we think that we need to intervene on when someone has sleep apnea so that we can help them feel better during the day. So definitely encourage them to, get checked out. I think that's one of the best things you can do because people are usually not conscious about what they're doing when they're sleeping.
Thank you for that answer, Dr. Padia. I see nods from our other two experts. This is a question. I know we touched on this before, but is restless legs syndrome more common in women? What can be done about it? And does my partner need to sleep in another room? Let's pass this to you first, Dr. Padia.
Sure, thank you. So just as an overview, restless leg syndrome is a condition where patients have a strong, often irresistible urge to move their legs, and it's usually accompanied by a difficult to describe uncomfortable sensation, and typically in both legs. The symptoms usually start, in the evening time when you're resting or getting ready to go to sleep, and they can sometimes even impact the ability for patients to fall asleep. So based on the literature, restless legs is, at least 2 times more common in females than males. And we know that also iron deficiency puts people at higher risk for restless legs. In addition, we don't know exactly why women are more, often seen with this condition, other than hormonal changes related to the menstrual cycle, as well as deficiencies in iron and differences in iron metabolism and genetics. Diet can also play a role. So if you're not getting enough iron in your diet, that can contribute as well. And then, when it comes to your other question about does somebody need to stay in a different room? I think that, overall, if somebody has restless legs, those symptoms tend to happen as you're falling asleep or as you're, trying to get ready to fall asleep, resting. It's something that you have the symptom of and you can sense. Another syndrome called periodic limb movements of sleep that is common in people that have restless legs can have that symptom of the legs moving around at night while they're sleeping. So two different conditions. But if somebody is moving their legs around a lot at night, they can, and it's bothering the other bed partner, you could consider staying in a different space if it's that bothersome. But I would recommend trying to get treated for an underlying sleep disorder if that's the case. When it comes to treatment for restless legs, there are medication treatments and non-medical treatments that people that have restless legs can seek. So definitely talk to your provider about, if you feel like you have those symptoms.
Thank you so much for expertly handling our last two questions, Dr. Padia. And I have a third one for you. Someone's come and circled back on our snoring question. How do I know if I snore? I think we answered that. If there is a bed partner, they could alert you to that. But how do I know if I snore? Do women snore more than men? And how do I know if it's sleep apnea? By the way, if we're talking about the Bottomley household, I snore a lot more than my wife. So just to repeat those questions, how do I know if I snore? Do women snore more than men? And how do I know if it's sleep apnea?
Yeah, that's a really great question and a very important question to answer. So I will say that, you know, we said before, snoring is kind of a screening tool that sleep doctors and other providers use to sense if somebody has sleep apnea or not. If somebody says, I snore, then we say the likelihood of you having sleep apnea is pretty significant. But it doesn't mean that somebody that doesn't snore doesn't have sleep apnea. And particularly in women, women tend to have that symptom much less than men. So sometimes, you know, symptoms of sleep apnea can be more subtle in females. It could be as little as noisy breathing, sometimes having pauses in breathing. And, you know, a bed partner may not be able to pick that up. And the patient, of course, themselves can't pick it up either. So definitely, you know, talk to your partner, talk to your, you know, friends, family, whoever is with you whenever has seen you sleep. If they notice anything unusual about the way you sleep, if you have pauses in your breathing, if you have little arousals and gasping for air, things like that can help us, you know, consider that diagnosis. But really, if you have any kind of daytime symptoms of excessive daytime sleepiness, that could also lead us down that path as well. So I forget the second part of your question. Sorry.
Sure, no problem. So the general question was looking into snoring. How do I know if it's sleep apnea? Was the final part.
Thank you. Yeah, really, the only way to know if it's truly sleep apnea or not is via testing. So there are home sleep apnea tests and in-lab sleep tests. The in-lab sleep tests are the one that can definitively tell if you have sleep apnea or not. The home sleep apnea tests are, again, something that we use as a screening tool for patients that have, you know, pretty significant symptoms of sleep apnea. Those will be likely positive and we can get treatment for those patients easily. But if a home sleep apnea test is negative, it does not rule out the fact that they may have sleep apnea. And we do encourage those folks to get an in-lab sleep study following that to definitively rule out sleep apnea.
Thank you so much for that, Dr. Padia. We have about 7 or 8 minutes left. It looks like we have 3 questions left, so I think we can get through those. This one I'm going to pass to you, Dr. Shelgikar, Dr. Conroy. How is research done for women and sleep? Is there still a lot we don't know? And what types of disparities exist in research and clinical practice?
Is this a need? Yes, definitely it's a need. You know, again, we talk about sleep medicine being a relatively young field, kind of born in the 1950s, so to speak. And so, you know, a lot of the work that initially started was kind of looking at, you know, adults, or really thinking about lifespan and age. And then as we have been learning more about the physiology of disordered sleep, of, you know, sleep quality, of sleep need, and the individual variation between these, we are also understanding that there is likely a difference in all of these things between men and women. So for right now, where our science stands, we use the same diagnostic criteria for sleep disorders in adults, regardless of sex or gender. And we're coming to find, though, that maybe we do need to be more nuanced in our understanding and in the diagnostic criteria, for example, maybe even in selection of treatment modalities. So there is a lot of work yet that needs to be done. I think we have found, that there are some sleep disorders that are more common in women, others that are more common in men. And we tend to say, okay, the population that tends to have these disorders more than the outcomes, and then we kind of extrapolate that to the general population. And so where our research is starting to head, and where we definitely need more science, is really understanding these subtleties that may influence the way people need to approach sleep disorders based on gender-specific influences, and then even, again, really personalizing treatment as well.
Thank you. I don't know if you want to add anything, Dr. Conroy, Dr. Padia.
I would just add that I think we have a long way to go in terms of understanding the complexities of women's bodies and the hormonal cycles and how that affects sleep. I think in the past we've perhaps even excluded on the basis of variations in hormones for the sake of a clean research study. And the truth is that it's very complex, and we need a better understanding of the complexities of the hormonal influences on sleep.
Thank you so much. Thank you both for answering that one. And finally, I'll pass this to you first, Dr. Padia. For trans men and others who are assigned female at birth, are there additional concerns for sleep health?
Thank you so much for that question. I think it's really important. And I'm glad to say that we are doing some research about that at University of Michigan. So recent research led by Dr. Gavidia, actually here at the Sleep Disorders Center, showed that transgender youths are 5.4 times more likely to have insomnia and 3 times more likely to have sleep apnea or other sleep-related disorders. The research also showed that youth who had gender-affirming therapies almost had half the likelihood of having these sleep disorders. And so compared to those who were not started on therapy. And so while there's more research underway, I think what we do know is that there's heavy interplay between mental health disorders and insomnia, which probably play a large role in the findings. But at the same time, we've also seen some research that's shown that trans masculine patients on testosterone are more likely to have insomnia and more severe sleep apnea than those that aren't not on testosterone. So if you're going through that process, keep an eye on your sleep-related symptoms and talk to your healthcare provider if you have any emerging issues regarding your sleep.
Thank you so much for that. As we wrap this up, I always like to ask our experts, is there anything you think we've missed? Do you have any final thoughts? So before I move into the closing and share a website and some resources, I'd like to ask you three that. Perhaps we can start with you, Dr. Shelgikar.
Sure. Just want to thank you all for joining us today, and for Ed for leading us through this session, answering and raising some really, really critical questions about sleep and women's health. The take-home point I would like to re-emphasize is really that sleep is essential to health, and we all have our individual biological needs for sleep. And so if there is a concern about the quality of the sleep that you're getting or the quantity of sleep that you're getting, that's really something to talk about with your healthcare provider, because we know that it has an influence on our overall health and well-being.
Dr. Padia?
Sure. I think the only thing I would say is, like I said before, sleep disorders in women, especially sleep apnea, can be more subtle and is often overlooked. So if you have any sleep-related concerns, definitely bring them up, like Dr. Shelgikar said. Sometimes treatment of an underlying sleep disorder can be the low-hanging fruit to, you leading a better life and a more energetic life. So definitely pay attention to your symptoms and get treated.
And Dr. Conroy?
Yes, thank you. And thank you everyone for joining. I do want to emphasize that I hope that sleep doesn't seem like a luxury. It is something that we can all perhaps take a moment out of the day, whether it's just taking 5 seconds to breathe. Breathing is free. And I understand that the interventions that we've talked about take time and money. And if you can just maybe take some of the maybe environmental tips, or just maybe just calming the mind a little bit by taking a few deep breaths at night, that's something accessible to everybody.
Yes, thank you so much, all three of you. Thank you to our viewers for joining us today, to our panelists for a really great discussion on optimizing sleep health for women. If you missed parts of this live stream, we'll have it posted on our Michigan Medicine social channels. It will also be on our Michigan Medicine flagship YouTube page. For more sleep information, you can go to uofmhealth.org/better-sleep. Or for resources, you can go to sleepeducation.org. So once again, thank you to our three experts, Dr. Padia, Dr. Shelgikar, Dr. Conroy, and thank you to our viewers.